When little Fatima Atwi was born, she seemed to be perfectly healthy. But a few weeks later, she developed severe diarrhea. After days with no improvement, the concerned Atwi family took baby Fatima to a local hospital where doctors decided her condition was serious enough to send her to the emergency department at the Children's Hospital of Michigan. Dr. Joseph Lely, surgeon-in-chief at Children's, was one of Fatima's doctors.
She had such a severe infection that it challenged the blood supply to a major portion of her intestine. And she, instead of responding quickly to routine measures, she kept deteriorating.
As doctors tried to figure out what was wrong with Fatima, she had a cardiac arrest. Medical professionals trained in neonatal resuscitation were at Fatima's bedside instantly to keep the 1-month-old infant alive. Once she was stable, abdominal x-rays revealed the infection was continuing to spread, and her swollen intestines were making it hard for her to breathe. Doctors determined her only chance for survival was surgery. Dr. Michael Klein, Philippart Chair of Pediatric Surgical Research on staff at the Children's Hospital of Michigan, performed the operation.
After we opened up Fatima's abdomen, we removed all the intestines from the abdomen so that we could carefully examine them. When we found that all of the intestine looked equally bad, we decided that the best thing was to leave them outside the abdomen so that she'd be able to breathe, and we covered them in this plastic bag so that we could care for her in the meantime. We kept watching her and supporting her with antibiotics, with the breathing machine to breathe for her.
Time passed, and Fatima became more and more sick.
We actually watched her bowel die. It just turned black, fell apart into little pieces, and settled back down into the abdominal cavity. I was certain that with that much dead intestine inside, that she would die in a few days.
Fatima's mother, Bara, of Dearborn, Michigan, kept a constant vigil at her daughter's bedside. Her husband, Fadl, was out of the country during Fatima's illness, and both of Fatima's parents spoke very little English, so Bara's sister stayed close by to act as an interpreter.
My feeling, it was very bad for her as a mother. I was feeling the pain that my daughter was feeling. I went and I met this doctor in Lebanon. I took the file for Fatima and tell him my daughter, now she's getting treated at Children's Hospital. Her doctor is Dr. Klein. He goes, stop there. When he said Dr. Klein, he said, don't worry, your daughter, she's in a good hands.
So the Atwi family put their faith in God and the experts at the Children's Hospital of Michigan. And miraculously, over the coming months, Fatima started getting better.
We decided that we should re-explore the abdomen to find out what intestine was there and if there was anything we could hook together.
Dr. Klein called Bara's sister Rana to tell her the news, and she called Bara.
I want to tell you that Dr. Klein called us, and he just told Azam, your daughter, some of her intestine went back life inside of her stomach. She started screaming, like you can't hear her noises, screaming, like she's getting loudy, happy,
When we reoperated on Fatima, we found that most of her bowel was dead. Probably 75 to 80% of her intestine was gone. We found about 50 centimeters of bowel that was left, and we put those two ends together.
Following the surgery, Fatima was put on intravenous nutrition as her main food source, and her body continued to heal. After her discharge from the hospital, Fatima became one of the first patients at the Children's Hospital Intestinal Rehabilitation Program, also known as CHIRP.
In that team, there is a pediatric surgeon, there is a pediatric GI specialist, a pharmacist, a nutritionist, social worker, nurse practitioner, and physical therapy and occupational therapy. So all those different disciplines see her all at one time so that we can provide a unified care plan for her, kind of a one-stop.
As Fatima nears her 5th birthday, she continues to surprise her doctors and is eating all her food by mouth.
We have close to 40 or 50 children out in the community that are on various amounts of enteral and IV nutrition, but she's the star of the whole group.
Hi, Dr. Klein.
She has a very short intestine, but she is able to absorb enough nutrition to be of her IV nutrition. Fatima is a real ambassador for us. She has a very outward personality. I think it's because she has had all of these people that she's gotten to know over these couple years now, and she considers us her friends. And so it's like a social event when she comes to the clinic.
You would never know that she'd suffered through all of these events. I think that her future will be whatever she wants to make of her future.
بتمنى كنا بدنا ناجحين وتكبر
My dream is for Fatima to grow up, go to school, learn, to be a future doctor, to treat other kids like she got treated from other doctor for the same problem.
Thank you, Dr. Klein. Thank you so much. I love you, Dr. Klein.
All the surgery doctors were nice, but Dr. Klein, he's my special doctor.
والدكتور كلاين اللي
I want to thank Dr. Klein and all the staff at Children's Hospital. Because of him and God's hand, he kept her alive till this day. Look at her right now. She's in my hands, perfect.